Did you know that you could have a stroke and not even realize it? Silent strokes often show no immediate symptoms, yet they can cause serious long-term brain damage and increase the risk of future, more severe strokes. In this eye-opening video, we'll uncover the hidden dangers of silent strokes, how they affect your health, and the warning signs you should never ignore. Stay tuned to learn how to protect yourself and your loved ones from this silent but serious threat. We all know about strokes. They are sudden, often debilitating events that can change a person's life in an instant. When we think of a stroke, we usually imagine someone experiencing severe symptoms like sudden weakness, difficulty speaking, or even paralysis. These are the classic signs that prompt immediate medical attention. They are scary and dangerous. The urgency and fear surrounding a stroke are well-founded because the quicker the response, the better the chances of recovery. But what if there was a type of stroke that didn't announce itself with such dramatic symptoms? But did you know there's a type of stroke that often goes unnoticed? This type of stroke doesn't come with the usual warning signs. It sneaks in quietly, without causing the immediate obvious damage that we associate with a typical stroke. It's called a silent stroke. The term itself might sound paradoxical because we usually think of strokes as anything but silent. However, silent strokes are more common than you might think, and their effects can be just as serious over time. Just like a regular stroke, a silent stroke happens when blood flow to a part of the brain is blocked. This blockage can be caused by a clot or a burst blood vessel, leading to a lack of oxygen and nutrients in the affected area. This blockage damages brain cells. The affected brain cells begin to die, and this damage can accumulate over time, leading to more significant issues down the line. However, with a silent stroke, you don't experience the obvious symptoms. You might not feel any sudden weakness, have trouble speaking, or notice any immediate changes in your ability to move. This lack of symptoms is what makes silent strokes so insidious. Imagine a small, hidden leak in a pipe. At first, it might seem insignificant, just a few drops of water escaping here and there. But if left unchecked, that small leak can lead to major problems. Over time, even a small leak can cause significant damage. The water can seep into walls, weaken structures, and create an environment for mold and decay. Similarly, silent strokes can cause cumulative damage to the brain. That's what a silent stroke is like, a silent threat to your brain health. Without the dramatic symptoms to alert you, silent strokes can go undetected for years, slowly impairing cognitive functions, memory, and even leading to more severe strokes in the future. It's crucial to be aware of this hidden danger and take steps to protect your brain health through regular checkups and a healthy lifestyle. Silent strokes are sneaky. They can occur without any immediate obvious symptoms, making them particularly dangerous. Unlike major strokes, which have clear and sudden signs, silent strokes can go unnoticed for a long time. You might not even realize you've had one. These strokes can happen without causing any pain or dramatic changes, which is why they are often called silent. However, their impact on your brain is very real and can accumulate over time. But there are subtle clues your body might give you. Paying attention to these signs can help you catch a silent stroke early and seek medical attention before more serious damage occurs. Have you noticed any sudden changes in your walking or balance? Even minor difficulties in coordination or a slight unsteadiness can be a red flag. These changes might seem insignificant, but they can indicate that a part of your brain has been affected. Do you sometimes feel dizzy or lightheaded for no apparent reason? This unexplained dizziness can be a sign that your brain is not getting enough blood flow, which could be due to a silent stroke. These could be signs of a silent stroke. It's important to discuss these symptoms with your doctor, even if they seem minor. Early detection can make a significant difference in managing the effects of a silent stroke. Other subtle changes include a slight drooping on one side of your face or difficulty speaking clearly. These symptoms might come and go, making them easy to overlook, but they are crucial indicators of a potential problem. You might experience temporary memory lapses or find it hard to concentrate. These cognitive changes can be frustrating and might be mistaken for normal aging, but they can also be signs that your brain has been affected by a silent stroke. Being aware of these subtle signs and seeking medical advice can help you protect your brain health and prevent further strokes. You might be thinking, if there are no major symptoms, why worry? It's a common question and it's understandable. After all, if you don't feel anything wrong, it can be hard to believe that something serious might be happening inside your body. But the truth is, silent strokes are a hidden danger. They don't announce themselves with dramatic symptoms, but their impact can be just as severe over time. But early detection of silent strokes is crucial. These strokes can occur without any immediate, noticeable symptoms, making them easy to overlook. However, they can still cause significant damage to your brain. By identifying these strokes early, we can take steps to mitigate their effects and prevent further harm. Think of it like this. Every silent stroke leaves a tiny scar on your brain. These scars might be small, but they are not insignificant. Each one represents a point of damage, a place where brain cells have been affected. Over time, these small scars can add up, leading to more serious health issues. Over time, these scars can accumulate, increasing your risk of a major stroke in the future. It's like a ticking time bomb. The more silent strokes you have, the higher your risk becomes. This is why it's so important to catch them early, before they have a chance to do more damage. Early detection allows for timely intervention. When we catch these silent strokes early, we can start treatment right away. This might include medications to prevent further strokes, lifestyle changes to reduce risk factors, or other medical interventions. The goal is to stop the damage before it gets worse. This means we can address potential risk factors and work towards preventing further damage. By managing conditions like high blood pressure, diabetes, and high cholesterol, we can reduce the likelihood of future strokes. It's about taking control of your health and making proactive choices to protect your brain. Remember, when it comes to brain health, every second counts. The sooner we detect and address silent strokes, the better our chances of preventing a major stroke down the line. Don't wait for symptoms to appear. Take action now to safeguard your brain and your future. The good news is that even though silent strokes are serious, there are things you can do. Treatment focuses on preventing future strokes. Your doctor might recommend medications to control blood pressure, lower cholesterol, or prevent blood clots. These medications help reduce the risk of further damage to your brain. Lifestyle changes are equally important. A healthy diet, regular exercise, and not smoking can make a big difference in your overall brain health. Taking control of your health is empowering, and it's simpler than you might think. Let's break down some easy-to-adopt lifestyle changes. First and foremost, get moving. Aim for at least 30 minutes of moderate-intensity exercise most days of the week. Think brisk walking, cycling, or even dancing. Exercise benefits your brain as much as your body. Next, prioritize sleep. Aim for 7 to 8 hours of quality sleep each night. Sleep is crucial for your brain to repair and rejuvenate itself. Remember that saying, "You are what you eat"? It's especially true for your brain. Opt for a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Think of these foods as superfoods for your brain. Blueberries, salmon, walnuts, and spinach. They are packed with nutrients that support brain health. Remember, a healthy diet isn't about deprivation, it's about nourishing your body and mind. Just like we exercise our bodies, it's important to exercise our brains too. Engage in activities that challenge your mind and keep it sharp. Try puzzles, crosswords, Sudoku, or even learning a new language. Social interaction is also crucial for brain health. Connect with loved ones, join a club, or volunteer in your community. Remember, a happy and engaged brain is a healthy brain. Remember, I'm here to guide you, but I can't do it alone. If you suspect you may have had a silent stroke or are experiencing any of the symptoms we discussed, please don't hesitate to reach out to your doctor. Your doctor is your partner in brain health. They can perform tests to assess your risk and recommend the best course of action for you. Early detection and proactive management are key to protecting your precious brain health. Remember, knowledge is power. By understanding silent strokes and taking proactive steps towards prevention, you're becoming your own health advocate. Don't be afraid to ask questions, seek support, and prioritize your well-being. Your brain is incredible and it's worth protecting. Together, let's fight back against silent strokes and prioritize brain health for all. Thanks for watching. Until next time, subscribe for more health and wellness tips.